Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: can I take propranolol for anxiety symptoms? Many individuals encounter transient anxiety episodes at different stages in life. Anxiety is a typical human reaction to perceived threats, often resulting in various physical and mental symptoms. While feeling anxious during stressful life circumstances and significant changes is ordinary, some individuals may experience a more severe and incapacitating form of anxiety that negatively affects both mental and physical well-being. Let's delve into the utilization of propranolol for distinct types of anxiety, comprehending its mechanism of action, its efficacy in alleviating anxiety, potential side effects, and optimal methods of administration. How to use propranolol for anxiety. This medication is a beta blocker utilized in managing high blood pressure, irregular heartbeats, tremors, and other medical conditions. It plays a role in post-heart attack care to enhance survival rates. Additionally, it is employed for preventing migraine headaches and angina, chest pain. Reducing elevated blood pressure aids in averting strokes, heart attacks, and kidney complications. Minimizing chest pain can enhance one's ability to engage in physical activities. The drug operates by impeding certain natural chemicals, like epinephrine, that impact the heart and blood vessels, subsequently reducing heart rate, blood pressure, and cardiac strain. Side effects of propranolol for anxiety. You may experience dizziness, lightheadedness, or fatigue as your body adapts to the medication. Additionally, nausea, stomach discomfort, changes in vision, difficulty sleeping, and unusual dreams might occur. If any of these effects persist or worsen, promptly inform your doctor or pharmacist. To minimize the risk of dizziness or lightheadedness, rise slowly when transitioning from sitting or lying down to standing. This medication might reduce blood flow to your hands and feet, resulting in a sensation of coldness. Smoking may exacerbate this effect. Dress warmly and refrain from tobacco use. Propranolol for anxiety warnings. Do not discontinue using this medication without consulting your doctor first. Suddenly stopping this drug may worsen your condition, especially if you suffer from chest pain, angina, or heart conditions like coronary artery disease, ischemic heart disease, or high blood pressure. If your doctor advises discontinuation, it's crucial to gradually reduce your dosage following your doctor's instructions. During the gradual cessation of this medication, it's recommended to temporarily limit physical activity to reduce stress on the heart. Seek immediate medical attention if you experience exacerbated chest pain, tightness or pressure in the chest pain radiating to the jaw, neck, or arm, unusual sweating, difficulty breathing, or rapid, irregular heartbeat. Propranolol for anxiety interactions. Medication interactions can alter how your drugs function or heighten the risk of severe side effects. This list doesn't cover all possible drug interactions. Keep a comprehensive record of all products you use, including prescription, non-prescription drugs, and herbal supplements, and discuss them with your doctor and pharmacist. Refrain from starting, stopping, or adjusting dosages of any medicines without your doctor's guidance. Several products may interact with this medication, including alpha blockers, like prazosin, aluminum hydroxide, chlorpromazine, and other high blood pressure medications, such as clonidine, hydralazine, methyldopa. Additionally, products like fezolinetant, fingolimod, haloperidol, heart medications, like digoxin, disopyramide, propafenone, quinidine, mefloquine, rizatriptan, theophylline, thioridazine, thyroid hormones, such as levothyroxine, and warfarin might interact with propranolol. Moreover, other drugs may impact the elimination of propranolol from your system, affecting its effectiveness. Such drugs include cimetidine, St. John's wort, specific SSRI antidepressants, such as fluoxetine, fluvoxamine, paroxetine, rifamycins, like rifabutin, and others. Certain products contain components that might elevate your heart rate or blood pressure. Inform your pharmacist about the products you use, particularly cough and cold medications, diet supplements, or NSAIDs such as ibuprofen, naproxen, and inquire about their safe usage. Is propranolol for anxiety a good treatment approach? The effectiveness of propranolol for anxiety depends on various factors and individual circumstances. Propranolol primarily targets the physical symptoms of anxiety, such as rapid heartbeat, trembling, and sweating, by blocking the action of certain stress hormones. It is commonly used for situational anxiety, such as performance anxiety or public speaking. While propranolol can relieve physical symptoms, it does not address the underlying psychological causes of anxiety. Therefore, it may not be suitable for everyone, especially those with primarily cognitive or emotional symptoms. Propranolol is generally well tolerated but can have side effects, including fatigue, dizziness, and low blood pressure. It is essential to consult with a healthcare professional who can evaluate your specific situation and provide personalized advice. Propranolol dose for anxiety. The appropriate dose of propranolol for anxiety can vary depending on several factors, including the severity of symptoms, individual response, and the specific situation in which it is used. It is crucial to consult with a healthcare professional, such as a doctor or psychiatrist, who can assess your condition and provide personalized dosing instructions. Typically, for situational anxiety, a single dose of propranolol taken before the anxiety-inducing event may be sufficient. The dosage can range from 10 to 80 milligrams, with 20 milligrams to 40 milligrams being a common starting dose. The effects of a single dose usually last for a few hours. The dosage may be adjusted and taken regularly to manage generalized anxiety. In such cases, the initial dosage, such as 10 milligrams to 20 milligrams, is often lower and can be increased gradually based on individual response and tolerability. Follow the healthcare professional's instructions carefully and not exceed the prescribed dosage. Abruptly stopping propranolol can lead to withdrawal symptoms, so it is essential to consult a healthcare professional for guidance on tapering off the medication when discontinuing its use. How quickly does propranolol work for anxiety? Propranolol's onset of action for anxiety can vary from person to person. However, in most cases, its effects are felt relatively quickly. When taken before a specific anxiety-inducing event, such as public speaking or performance, individuals often report a noticeable reduction in physical symptoms within 30 minutes to an hour after taking the medication. Propranolol primarily targets the physical symptoms of anxiety, such as rapid heartbeat, tremors, and sweating. It does not have an immediate impact on cognitive or emotional symptoms. Therefore, while the physical symptoms may diminish quickly, the psychological aspects of anxiety may persist. The duration of propranolol's effects is typically limited. The medication's effectiveness typically lasts for a few hours, with the peak effect occurring within 1–2 hours after ingestion. This shorter duration makes propranolol well-suited for situational anxiety rather than long-term management of generalized anxiety. How does propranolol work for anxiety? Propranolol, a beta-blocker medication, works for anxiety by blocking the effects of certain stress hormones in the body, specifically adrenaline and noradrenaline. These hormones play a role in the body's fight-or-flight response, activated during stress or anxiety. When faced with a stressful situation, such as public speaking or performance, the body releases adrenaline and noradrenaline, leading to physical anxiety symptoms like rapid heartbeat, trembling, and sweating. Propranolol works by binding to beta receptors in the body, which are the sites where adrenaline and noradrenaline typically bind. By occupying these receptors, propranolol prevents the stress hormones from exerting their effects, thereby reducing the physical symptoms of anxiety. By targeting the physical symptoms, propranolol can help individuals feel more physically calm and in control, allowing them to better cope with anxiety-inducing situations. Propranolol does not directly address the underlying psychological causes of anxiety or cognitive symptoms associated with anxiety. Therefore, it is often used with other therapeutic approaches for comprehensive anxiety management. The We Level Up Treatment Center network delivers recovery programs that vary by each treatment facility. Call to learn more. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.